Hello, future nurses and healthcare heroes, welcome to our channel Canadian Nurse Expert. Today, we're diving into the world of Guillain-Barré Syndrome, often called GBS. It's a rare but serious condition that affects the nervous system. As healthcare professionals, understanding GBS is crucial. We need to know how to recognize it, treat it, and support our patients through their recovery. GBS occurs when the body's immune system mistakenly attacks the peripheral nervous system. This system carries signals from the brain and spinal cord to the rest of the body. When these signals are disrupted, it leads to a range of neurological problems. The good news is that with prompt diagnosis and proper care, most people with GBS recover, although it can take time. The exact cause of GBS remains a bit of a mystery, but we know certain factors increase your risk. Often, GBS develops after a bacterial or viral infection. Think of it like a case of mistaken identity. The immune system, geared up to fight the infection, mistakenly attacks the nerves. Several risk factors are associated with GBS. These include recent respiratory or gastrointestinal infections, particularly Campylobacter jejuni. Additionally, certain viruses like the flu virus and Epstein-Barr virus have been linked to GBS. It's important to remember that while these factors increase the risk, most people exposed to them will not develop GBS. It's a complex interplay of factors, and more research is needed to fully understand why some individuals develop this condition. Guillain-Barré Syndrome is not a one-size-fits-all condition. It presents in various forms, each affecting the nerves in slightly different ways. Let's explore the most common types. Acute inflammatory demyelinating polyradicular neuropathy, or AIDP, is the most prevalent form of GBS, particularly in Europe and North America. In AIDP, the immune system damages the myelin sheath, the protective covering surrounding nerve fibers. This damage disrupts the transmission of nerve signals. Miller-Fisher syndrome, or MFS, is a rarer variant of GBS. It primarily affects the nerves in the eyes, causing weakness or paralysis of the eye muscles, unsteady gait, also known as ataxia, and absence of reflexes. Acute motor axonal neuropathy, or AMAN, and acute motor sensory axonal neuropathy, or AMSAN, directly target the nerve axons, the long, slender parts of nerve cells that transmit signals. AMAN affects only the motor nerves, leading to muscle weakness, while AMSAN affects both motor and sensory nerves, resulting in weakness and sensory disturbances. Time for a pop quiz! Could you recognize the signs and symptoms of Guillain-Barré Syndrome in a patient? Early recognition is key for effective treatment. The hallmark of GBS is progressive muscle weakness, often starting in the legs and spreading upwards. Patients may describe a tingling or pins and needles sensation in their extremities. In severe cases, this weakness can progress to paralysis, affecting the muscles responsible for breathing. Other common symptoms include difficulty walking steadily, difficulty with facial movements like smiling or swallowing, pain or cramping in the muscles, rapid heart rate, and fluctuations in blood pressure. Diagnosing GBS can be tricky because its symptoms mimic other neurological conditions. If you suspect a patient might have GBS, immediate medical attention is crucial. A detailed medical history, including recent illnesses, is the first step. A neurological examination assesses reflexes, muscle strength, and sensory function. Tests like a lumbar puncture, also known as a spinal tap, and nerve conduction studies can confirm the diagnosis. When should you advise a patient to seek immediate medical help? Anytime they experience sudden onset weakness, tingling, or difficulty moving their limbs. Early diagnosis and treatment are associated with better outcomes. While there's no cure for GBS, several treatments can lessen its severity and speed up recovery. Treatment typically involves intravenous immunoglobulin, or IVIG, which involves administering high doses of antibodies to neutralize the harmful antibodies attacking the nerves. Another option is plasma exchange or plasmapheresis, which involves removing a portion of the patient's blood plasma that contains the harmful antibodies and replacing it with healthy plasma. Alongside these treatments, supportive care is vital. This might include mechanical ventilation if the weakness affects the respiratory muscles, physical therapy to maintain muscle strength and prevent muscle atrophy, and psychological support to cope with the emotional and psychological impact of the illness. Remember, nursing care plays a crucial role in the recovery of GBS patients. Your compassion, expertise, and unwavering support can make all the difference in their journey back to health.